Few people know that the thickness of our blood isn't constant. It changes throughout the day. At night, when the body is at rest, blood tends to become thinner, especially around midnight. But in the early morning, when the blood begins to thicken again, this becomes the most dangerous time. At that point, blood vessels have already narrowed due to a drop in body temperature, and with the blood becoming thicker than usual, circulation becomes more difficult. And when blood struggles to flow, the risk of blood clots increases, one of the leading causes of early morning strokes. That's why understanding this natural rhythm is the first step to knowing how to protect your heart and brain every morning when you wake up. Sadly, most of us were never taught how to start the morning the right way. In this video, I'll share 7 simple and gentle habits that can significantly reduce your risk of stroke, dizziness, and loss of balance after the age of 50. And if you find these tips helpful, don't forget to click like and subscribe to the channel so you won't miss any of our daily health videos. Let's dive in. Habit 1. Lie still for 1 more minute. Give your brain and heart time to catch up with your body. You've just opened your eyes after a long night's sleep. The soft morning light filters through the curtains, and your first thought is, I need to get up. But wait, don't rush. The moment you suddenly sit up in bed is exactly when your heart rate spikes, your blood pressure surges, and your blood is still thick like a river that hasn't yet begun to flow. According to statistics from European health insurance companies, most strokes occur between 5 and 7 a.m., precisely when many people are just waking up. This is no coincidence. Our bodies operate according to a finely tuned biological clock, where blood pressure, blood vessels, and nervous system activity all shift depending on the hour. At night, the parasympathetic nervous system helps the body rest. Blood vessels dilate and blood pressure drops. But upon waking, the sympathetic nervous system takes over, increasing heart rate and raising blood pressure. Meanwhile, many peripheral blood vessels are still constricted from the lingering effects of sleep. The result is a dangerous contradiction. The heart is pumping harder, but the blood vessels remain tight, creating a high risk of stroke or heart attack, especially for those with a history of hypertension, ischemic heart disease, or sleepless nights. So instead of springing out of bed the moment your alarm rings, allow your body a gentle transition period. Lie still for 1 to 2 more minutes. During that time, you can slowly stretch your legs, gently move your wrists, inhale deeply through your nose, and exhale slowly through your mouth. That's it. Just 50 seconds of delay can significantly reduce your risk of sudden blood pressure spikes. For older adults, especially those on cardiovascular medication, this is not just a healthy habit, but a vital safety cushion before getting out of bed. The body needs time to sync up, just as the heart deserves to be awakened with gentleness, not alarm. If you've ever woken up feeling dizzy, off balance, or with sharp chest pain, it might not just be old age. It could be your body sending a warning that you need to start your mornings more slowly. And it all starts by lying still for 1 more minute. Habit 2. Drink a glass of warm water. Wake up your blood flow and digestive system. After a long night, you haven't just been resting. Your body has also quietly lost a significant amount of water through breathing and metabolism. Even without sweating, you're thirsty without realizing it. That's why, the moment you sit up, a glass of warm water is the first gift you should give your body. Water isn't just for soothing a dry throat. When consumed in the morning, especially on an empty stomach, it helps reduce blood viscosity, which thickens naturally after a long sleep. This is critically important, as thickened blood increases the risk of clot formation, one of the most common causes of strokes and heart attacks in older adults. Additionally, warm water gently awakens your digestive system. It stimulates bowel movement, cleanses the digestive tract, and helps eliminate residues accumulated from the previous day. For those who frequently suffer from bloating, indigestion, or constipation, this habit can make a noticeable difference after just a few weeks of consistent practice. Many people have the habit of drinking coffee or tea immediately upon waking. But remember, coffee is a diuretic. If consumed before replenishing your base hydration, it can further dehydrate the body. That's why warm water should be your first step, a prelude before your official breakfast. If you often struggle with constipation, you can add a teaspoon of honey to your glass of warm water. This gentle combination offers a natural energy boost, soothes the intestines, and enhances elimination. Ideally, you should drink about 150 milliliters of warm water, not too hot, to avoid irritating the stomach lining, and not too cold, to prevent blood vessel constriction. Think of that glass as a gentle stream flowing through your blood vessels, awakening every cell within you. A small action, just a few seconds each morning, but it can lay the foundation for an entire day of good health. Habit 3. Breathe slowly for 5 minutes. Wake up your brain. Stabilize blood pressure. When you wake up in the morning, the first thing that wakes isn't your body, it's your thoughts. Tasks waiting to be done, lingering worries from the day before, or simply a vague, nameless tension that makes your heart race and your mind feel foggy. Few people notice, but in that very moment, your body begins releasing cortisol, the stress hormone that raises blood pressure, destabilizes your heart rate, and constricts blood vessels. That's why taking 5 minutes each morning to breathe deeply is one of the simplest habits that can bring about major changes. No need for complicated meditation, yoga mats, or a perfectly quiet space. All you need is your breath, slow, steady, and intentional. Try closing your eyes, inhaling through your nose for 4 seconds, holding your breath for 4 seconds, then exhaling slowly through your mouth for 6 to 8 seconds. Repeat steadily for a few minutes. The first thing you may feel is lightness in your head, followed by the calming of your thoughts and a natural slowing of your heartbeat. Modern studies have shown that just 5 to 8 minutes of slow breathing can reduce blood pressure by 10 to 20 millimeters of mercury, a significant number for those at risk of stroke or heart disease. But this effect doesn't come from effort. It comes from release. Older adults are often more prone to tension after waking, especially after a sleepless night or when burdened by unresolved emotions. Sitting quietly and breathing deeply helps soothe the sympathetic nervous system, which tends to be overactive in the morning, lowering the risk of a sudden blood pressure spike caused by minor stress. The best part? You can do this while still sitting in bed or while waiting for the kettle to boil. Breathing costs nothing, yet it's the easiest way to regain clarity, peace, and control before stepping into a new day. Just remember, your breath doesn't just keep you alive, it helps you live longer, live healthier, and live more gently with each passing day. Habit 4. A proper breakfast. Avoid early morning traps of salt and fried foods. You should eat a big, delicious breakfast to have energy for the whole day. That's something many of us were told growing up. And it's true that after a long night, the body needs energy to reawaken its systems. But the issue isn't how much you eat, it's what you eat. In reality, Many people start their day with meals high in salt or grease fast food, sausage breakfast sandwiches, hamburgers, French fries. While these dishes are tasty, convenient, and easy to find, they are silent traps for the liver, blood vessels, and digestive system, especially for those over 50. Fried foods often contain high levels of saturated fat, which not only raises the level of bad cholesterol in the blood, but also burdens the liver. The liver is the body's main center for metabolizing lipids, fats. If you consume a large amount of fat from fried oil or fatty meats in the morning, while your liver has not fully woken up after the night, the excess fat may not be processed in time and will accumulate. Over time, this contributes to a higher risk of fatty liver disease, one of the silent yet common conditions among older adults. Moreover, an overly salty breakfast, such as salty cheese, sausages, pickled vegetables, or instant noodles, can cause a spike in blood pressure in less than an hour after eating. After waking up, your blood vessels are already slightly constricted and can be easily irritated by the sodium in food, increasing pressure on the heart and brain. A safer choice is a light yet nutritious breakfast. Oatmeal cooked with milk, boiled eggs with leafy greens, whole grain toast with avocado, or a smoothie with banana, flax seeds, and almond milk. These meals support digestion while providing steady energy without causing blood sugar or blood pressure spikes. You don't have to eliminate your favorite foods, but consider them as treats rather than daily habits. Breakfast is the foundation for a healthy day, so don't build that foundation with oil, salt, and sugar. Habit 5. Gentle morning movement. Kickstart circulation. Keep blood vessels flexible. Morning is a golden time for jump-starting both your body and mind. After lying still all night, your internal organs, especially the circulatory system, need to be gently but deliberately awakened. Just 10 to 15 minutes of light movement after waking can make a significant difference for your heart and brain health. Regular exercise has been proven to reduce many risk factors for stroke, including high blood pressure, obesity, dyslipidemia, diabetes, and even habits like smoking or alcohol consumption. Moreover, regular physical activity boosts levels of good cholesterol, HDL-C, and improves the function of the endothelium, the inner lining of blood vessels, which is key to maintaining elasticity and preventing coronary artery blockages. The American Stroke Association and the American Heart Association, AHA, recommend that healthy adults engage in moderate to vigorous exercise for at least 40 minutes, about 3 to 4 days per week. However, for older adults, it's not necessary to wait until you're sweating for it to count as exercise. Simple movements such as walking around the house, gentle stretching, massaging the neck, shoulders, back area, or slow joint rotations are enough to promote better blood flow, reduce muscle stiffness, and prevent sudden spikes in blood pressure. Especially helpful are exercises like neck rolls, shoulder rotations, stretches, shoulder shrugs, or slow walks under early sunlight. These are ideal for middle-aged and older individuals, not only improving circulation, but also reducing fall risk and enhancing coordination between limbs, which is vital for maintaining independence in daily activities. If you don't have time to go to the park or the gym, don't worry. Just being more active in your daily routine, like taking the stairs instead of the elevator, gardening, mopping the floor, or simply walking around the house while listening to music, already counts as meaningful movement. What matters isn't how much you exercise, but whether you do it consistently. A little motion each morning can help your heart pump blood more efficiently, your brain receive more oxygen, and your entire body step into the day feeling refreshed and light. Think of movement not as an obligation, but as a gift you give to your health every single morning. Habit 6. Check your blood pressure, 1 minute each morning, for a peaceful day ahead. There's something many people over 50 tend to overlook. High blood pressure doesn't only spike during stress or after salty meals. It can rise unexpectedly, even while you're brushing your teeth in the morning, and you might not feel a thing. This is known as morning hypertension, a particularly dangerous variation that often goes unnoticed. Numerous studies have shown that blood pressure follows its daily rhythm, influenced by hormones, sleep, and emotions. In the early morning, the body releases stimulating hormones like adrenaline and noradrenaline, which help you wake up, but also raise your blood pressure. For those with existing hypertension or elderly individuals, this can be a gateway to stroke or heart attack. Even those who manage their blood pressure well with medication can fall into this danger zone if they don't monitor regularly. One notable statistic shows that about 50% of hypertensive patients have elevated morning readings, even if their blood pressure remains stable during the rest of the day. This is why many stroke cases occur, not because the condition is severe, but because people don't realize it's quietly escalating right at the time they're making their morning coffee. That's why checking your blood pressure right after waking up, about an hour before breakfast, should be considered a daily mirror for your arteries. It only takes 1 minute, but it can help you stay ahead of the most dangerous fluctuations. Always measure on the same arm, rest for a few minutes beforehand, and if needed, take 2 to 3 readings 1 minute apart for accuracy. Additionally, if you often experience morning headaches, tingling in your face or arms, or mild chest discomfort, don't ignore them. These could be soft warnings your body is trying to send you. With a simple home blood pressure monitor, you can keep track of your safety every morning. And if you're on blood pressure medication, this habit is even more crucial because it helps you understand when the medicine is most effective and when to inform your doctor of adjustments. Morning hypertension isn't something you can feel, but it is something you can prevent with just one small habit. Make your blood pressure monitor a morning companion. It doesn't just measure numbers, it measures your trust in a healthy, proactive, and long life. Habit 7. Take medication on time, a small habit with big impact. After a long night, your body is like a machine just coming out of rest mode, and as you flip the morning switch with a glass of water, a light breakfast, or a few gentle stretches, there's one more important task that shouldn't be delayed: taking your medication exactly as prescribed. Many people take their medication whenever they remember, thinking it's fine as long as they take the full dose by the end of the day. But the truth is, timing plays a crucial role in how effective your treatment is, especially for blood pressure medications, heart support drugs, diuretics, and even vitamins. That's because each type of medication interacts differently with digestion, absorption, and blood concentration. Some need to be taken on an empty stomach to avoid interference from food. Others must be taken after meals to prevent stomach irritation, discomfort, or even damage to the stomach lining. And then there are special cases, medications that must be taken in the early morning, when circulation is just ramping up, to reach peak effect exactly when risk is highest, such as antihypertensives that prevent morning blood pressure spikes. One of the key medications that should be taken in the early morning is blood pressure medicine. According to cardiology experts, The timing of intake determines whether your blood pressure is well controlled during peak hours, typically between 6 and 9 a.m. Taking it too late can delay its effect, leaving a danger gap when blood may surge against vessel walls, leading to stroke or heart attack. Conversely, taking it too early, during the night, may cause the drug to wear off before the danger period even begins. Beyond blood pressure medication, drugs such as diuretics, central nervous system stimulants, to enhance alertness, and certain antibiotics that require good absorption are often recommended to be taken early in the morning when the stomach is empty and the body is waking up. Meanwhile, medications that cause drowsiness, such as sleep aids or sedatives, are more effective when taken in the evening. If you're taking multiple medications throughout the day, timing them to avoid conflicts or reduced absorption becomes even more critical. Be sure to consult with your doctor or pharmacist, or use a medication reminder app to schedule your doses wisely. And one more important note: avoid lying down immediately after taking medication. Wait at least 10 to 15 minutes to allow the pill to reach your stomach and reduce the risk of esophageal irritation or impaired absorption. If you often take your pills and go back to sleep, consider adjusting that habit slightly. Your body will thank you. A pill only works fully when it's welcomed at the right time, in the right way. So, make taking your medication on time an essential part of your morning routine. It's not just about following doctor's orders. It's how you give yourself the best chance at a healthier, more resilient life each day. Thank you for taking the time to stay with us until the end of today's video. If you found these morning habits helpful, don't hesitate to share them with your loved ones, because even one small change can help protect a whole lifetime. Remember, each morning is a new opportunity to care for your heart, nourish your mind, and live more fully every day. Wishing you good health, peace, and a fresh start, filled with positive energy. See you again in upcoming videos, where we'll continue our journey toward healthy living after 50.